Hello, everyone. Welcome back. Thank you for joining us. We're glad that you're here. I'm Steve,
And I'm Scott.
and together we're Backyard Musings, Science and Technology channel. On the screen, you can see there's 8 postures of Baduanjin. And we're going to talk about this, and I'm leaving this up for the duration so you can read this and maybe practice while Scott demonstrates this while we're talking.
Okay, here we go.
Okay, here we go. Study finds traditional Chinese practice may lower blood pressure as effectively as brisk walking and some medication trials. A traditional Chinese mind body exercise that combines slow, controlled movements, breathing techniques, and meditative focus has been shown to lower blood pressure as effectively as brisk walking. So when I first saw that, I was like, okay, it's Tai Chi. Everybody knows Tai Chi. It's not
Right.
Tai Chi. The findings come from a large randomized clinical trial published in JACC on February 18, 2026. It's the flagship journal of the American College of Cardiology. So it's the Journal of American College of Cardiology, where participants experienced reductions in blood pressure within 3 months that remained in place for a full year. Would you like to know more?
That's pretty good.
Yeah.
High blood pressure remains one of the most important preventable contributors to heart disease worldwide. While medical guidelines consistently recommend regular physical activity, maintaining exercise routines over time can be difficult. Many programs require access to equipment, dedicated facilities, or structured supervision, which can limit long-term participation for a large portion of the population.
Yeah. Talk about obstacles to entry. Not having the equipment, that's an obstacle.
Yeah.
All right, Baduanjin offers a different approach. This widely, and I'm going to spell it here, Baduanjin, Baduanjin. This widely practiced routine consists of 8 standardized movements that combine aerobic activity, muscle engagement, flexibility, and mind-body coordination. It has been practiced for centuries and is commonly performed in community settings across China. A typical session lasts about 10 to 15 minutes, as does not require equipment, making it easy to integrate into daily life. So 10 to 15. So it could go anywhere from a minute and a half to 2 minutes uh, per stretch body function
Exercise, whatever it is.
exercise. Yeah,
Yeah.
yeah. Because it involves low to moderate intensity movement, it is generally considered safe and suitable for a broad range of adults.
Okay, we like that. Stand upright. This is the first one. Stand upright with your feet shoulder width apart and keep your movement slow and controlled. Coordinate each motion with steady, deep breathing, inhaling and exhaling smoothly as you move. Sounds like almost like a meditate, or not meditation, but like a yoga type thing.
Yeah.
Move through the traditional 8 postures in sequence, focusing on posture, balance, and relaxation rather than speed or force. So you don't have to be rushed. That's good. And practice for about 10 to 15 minutes a day in the quiet space, maintaining calm attention throughout.
I would think
Okay.
that the first time you do this would take maybe 20, 30 minutes just to, looking at the description of what you're supposed to do and then doing it. And I would think the 10 minutes is when you really got it down. You know what you're doing. You clip along in just 10 minutes and you're done.
Right. Because are you supposed to do all of these at one time and like start it and finish it? Or can you do 4 and then do 4 later? No.
Well, they're all done together. I mean, one after the other
Yeah.
for 10
Right.
minutes.
Okay.
Quote, given its simplicity, safety, and ease at which one can maintain long-term adherence, Baduanjin can be implemented as an effective, accessible, and scalable lifestyle intervention for individuals trying to reduce their blood pressure, said Jing Li, medical doctor and PhD, senior author of the study, and director, Department of Preventative Medicine, National Center for Cardiovascular Diseases in Beijing, China.
Okay. To evaluate its effects, researchers conducted the first large multi-center randomized trial examining Baduanjin and blood pressure. The study followed 216 participants from 7 different communities, all age 40 or older, with systolic blood pressure levels between 130 and 139. What is that? Millimeters per, what is that?
Mercury. Mercury.
What is it?
Hg is the symbol, chemistry symbol for mercury.
Mercury, okay. Classified as stage 1 hypertension under the ACC, AAH, or AHA high blood pressure guideline. Participants were assigned to one of 3 groups for a 52-week period: Baduanjin practice, self-directed exercise, or brisk walking. So they mixed it up a little bit, sounds like.
Yes, I have 3 groups to compare to. The results showed that participants who practiced Baduanjin 5 days per week experienced meaningful reductions in blood pressure over both 3 months and 1 year. Their 24-hour systolic blood pressure dropped from about 3 milligrams of mercury, and office systolic blood pressure decreased by 5 milligrams of mercury, compared with those doing self-directed exercise. These reductions are in line with the effects seen in some first-line medications. At the 1-year mark, Baduanjin produced similar outcomes and a comparable safety profile to brisk walking.
An important finding was that these benefits persisted even without ongoing supervision. This is significant because many lifestyle interventions lose effectiveness once structured support is removed, highlighting the importance of approaches that people can maintain independently. That's kind of like the gym effect too, right? If you don't go to the gym, you buy a home weightlifting set or a what do they call that? One of those machines that people were buying a lot of, and you just don't have the desire to get up and do it. But if you go to the gym, drive to the gym, hang out, then people are more likely to do it. So, but anyway.
Okay, quote, Baduanjin has been practiced in China for over 800 years, and this study demonstrates how ancient, accessible, low-cost approaches can be validated through high-quality randomized research, said Harlem M. Krumholtz, medical doctor, FACC, editor-in-chief of JACC, and the Harold H. Hines Jr. professor at the Yale School of Medicine. Oh, that's a pedigree right there.
Okay. Ending here with a quote: the blood pressure effect size is similar to that seen in landmark drug trials, but achieved without medication, cost, or side effects. This makes it highly scalable for community-based prevention, including in-resource limited settings. So that slide that you had up there, that had all the different exercises.
All 8 with the description.
Yep. Right. So yeah, pretty cool. But I mean, 800 years, that's a proven track record, I would say.
Time tested, yeah.
Yeah. Okay.
All right, folks. Thanks for joining us. We hope that you have an awesome Sabbath. We'll see you on Monday.
Yep. Take care, everyone. Have a great rest of your weekend. Thank you.